Thank you, sir. Good evening, one and all, and thanks Diabetes India for this opportunity. So, I'll be speaking on a real-world data study. That's the GREAT study. So, it's a real-world study on glycemic outcomes in type 2 diabetes mellitus patients treated with glyclazide alone and in combination with other anti-diabetic medications. So coming to the introduction, so type 2 diabetes, we all know it's a chronic metabolic disorder with insulin resistance and progressive beta cell dysfunction. There is a need for glycemic control, and we have studied that from UKPDS and other bigger trials that good glycemic control can reduce the micro and also the macrovascular complications. Role of glyclazide, we all know that glyclazide is a second generation sulfonylurea with effective glucose lowering properties, lower risk of hypoglycemia compared to other sulfonylureas, commonly prescribed alone or with metformin or with other agents. There is a gap in evidence because the limited large scale real world data on glyclazide in India is especially lacking. So glyclazide is a modern sulfonylurea. It has got good glycemic control, and we have the large guide study which has shown it reduces hypoglycemia and compared to other second generation sulfonylurea. CV safety has been proven with the large advanced trial, lesser weight gain in some of the trials, and it has got some additional advantage like antioxidant property and lesser beta cell failure, and a good data on use in fasting condition like in Ramadan. So this was the basis why glyclazide was taken in this study. So rationale for the study was that there is an unmet need because we lack a real world data from glyclazide in our country. Clinical impact, what it will change is supports data driven treatment modifications, and it will enhance the understanding of the real world therapeutic effectiveness of this molecule in type 2 diabetes patients. So this is the study objective. It is to evaluate the glycemic effectiveness and safety of glyclazide alone and with other anti-diabetic drugs. It will provide insights for optimizing diabetes management in routine clinical practice. So there are 25 sites in India which have involved. Number of patients recruited were 1000, and follow-up of the study has been planned for 3 and 6 months interval. So this is a large real world data, and we are just presenting the baseline data because still the 3 and 6 months data is yet to be received. The study methodology, the patients enrolled GRID study were sulfonylurea naive patients aged more than 30 years. The fasting plasma glucose were more than 126 milligram per deciliter, and the HbA1c level was more than equal to 7%. The BMI was more than equal to 18 kg per meter square. The data would be analyzed for the changes in HbA1c at 12 and 24 weeks. This is an analysis of baseline characteristics of the study. As I have told, this is just the baseline characteristics of the study. So what was the baseline characteristic for this study? The total 1001 patients were enrolled. The mean age of the patients who were included is 52.87 years. The mean BMI was 26.8 kg per meter square, and there was almost male and female representation were almost similar. So the total number of patients, if we divide in the age group wise, the largest number of population were taken between 50 to 65 years at 60%, and the gender distribution was almost same between male and female. So majority of the patients prescribed glyclazide or its combination are in the range of 50 to 65 years in our study. So the glyclazide treatment patterns, we tried to find out how many of them were on monotherapy, how many of them were on dual therapy or in combination therapy of more than 2 anti-diabetic agents, and it was found that monotherapy used with glyclazide was quite low versus dual therapy was around 36%, and combination therapy of more than 2 drugs where one of them is glyclazide has been the highest with 55.14%. So 91.8% of the patients are prescribed more than one drugs. So the most common used dual and more than dual therapy were glyclazide plus metformin. So that was the most commonly prescribed medication in this real world setup, and followed by glyclazide plus linagliptin and glyclazide plus dapagliflozin. The most common comorbid condition at the baseline were hypertension, and as expected, it's the most common comorbidities in diabetes, followed by hypothyroidism and dyslipidemia. And coronary artery disease were only present in 24 patients. Baseline glycemic parameters, the fasting plasma glucose was 170, ppg was 249 milligram per deciliter, and the baseline A1C was 8.9%, 8.59%. So as I've told, this is just a baseline characteristic of a large real world data, and the conclusion what we can get from the recruitment is glycoside remains one of the key options in type 2 diabetes management. Combination therapy is widely prescribed in the real world setup, and follow-up data will provide deeper insights for personalized treatment strategies. So the final data will be coming out shortly with the 3 months and 6 months HbA1c data. So with that I'll end. Thank you for the patient.